Hi, my name is Laura Tham. I am a first-year medical student over at OSU CHS.
Hi, my name is Zohaib Thayani. I'm a first year at Oklahoma State Medicine, and I just kind of wanted to give a little bit of an intro as to the background of this research project. So healthcare workers usually rely on reputable and up-to-date research regarding clinical decision-making in order to provide high quality of care in the field. And usually this allows for understanding the important changes in medicine that are always occurring, whether that's medications or lifestyle regimens or any other type of therapeutic used, specifically in a clinical setting or outside. And for this reason, scientific peer-reviewed journals are usually the source for this. This is because journals must go through a rigorous process to be approved, perform the studies, and then even to publish the data. There's a whole team of editors that maintain the journal and the writers. As mentioned, there's also usually peer review that goes in before a particular study gets mentioned or published. And even sometimes you must be approved before even receiving the instruction for authors, as we found out. So because journals have such high priority in medicine, when clinicians are looking at their data, they must be held to strong standards in order for the data to be most refined. So we measured guidelines and clinical registration trials to see whether or not the journals are requiring, recommending, or even showing or mentioning certain guidelines for reporting. We also looked at the requirements, recommendations, and mentioning of clinical trial registries, which was another factor when assessing a journal's reporting.
As you can see in the methods, during this process, we identified the top 100 pulmonary and respiratory medicine journals using the Scopus Site Score tool. In this analysis, we sent emails to the editor-in-chief of each journal to determine which study types they included or excluded from their journal. We analyzed journals and their instructions to authors to determine which guidelines the journals required the authors to adhere to in order to be published. Two of our investigators analyzed each journal's instructions for the authors separately in order to avoid bias and error.
So for our results, of the top 100 pulmonary and respiratory medicine journals, approximately 60% required clinical trial registration. Equator was mentioned in 30% of included journals. The most frequently required guidelines were Consort at 29% and Prisma at 20%. And the least mentioned reporting guidelines were Quorum at 99%, so only one journal that was studied even mentioned it. And Prisma P was at 75%, CoreQ at 74%, and Cheers at 74%. And there was a significant association noted between the mentioning of the Equator Network and reporting guideline recommendations and requirements. However, Equator mentioned in the instructions for authors was not statistically associated with increased clinical trial registration requirements.
In conclusion, our findings showed that adherence to reporting guidelines are not frequently required by journals specifically in respiratory and pulmonary medicine. On the other hand, the majority of journals in pulmonary and respiratory medicine were requiring clinical trial registration. Adhering to research guidelines as well as registering in clinical trials improves the overall research quality as well as limits the biased reporting of journals coming from a particular database. Overall, our findings indicate that current pulmonary and respiratory medicine literature can benefit from increased reporting guideline adherence. Our thanks go to the Vassar research team for their guidance and support. We also could not have done this without John Goodell from our own OSU CHS Medical Library for his help in developing the project.